Hi friends, today we will discuss about one very important topic in ENT. As you know that ENT forms almost 7 to 8 questions in your entrance exams, and of this 7 to 8 questions, at least, believe me, at least 2 to 3 questions will be from this topic that we are going to discuss today, that is about CSOM. We will divide this topic into 3 parts, that is safe CSOM, unsafe CSOM and complications of CSOM. We will start with safe CSOM. So first topic we discuss is a safe CSOM. Now as the name suggests, remember safe CSOM is a term which is not very commonly used nowadays, but yes, it can be asked in MCQs, so you should be aware about. The other names for this term is tubotympanic disease, or it can be a more commonly used recent terms, especially in postgraduate books, is mucosal CSOM. So safe CSOM is also called tubotympanic disease, also called as mucosal CSOM. So any MCQ in which you find these topics, you need to understand, yes, the questions or the examiner wants to know about safe CSOM. First of all, what is it? So when you approach a question, you should be aware what the disease is. So let us just try to understand this disease, that is safe CSOM, or why is it called mucosal CSOM. Remember friends, our ear, nose, throat is all connected. There is a connection. I am sure all of you know eustachian tube, which connects nose from nose to the ear. The length of eustachian tube 36 millimeter. Remember again an important MCQ, the length of eustachian tube and length of external auditory canal. These two are slightly confusing. You should remember length of eustachian tube is 36 millimeter and length of external auditory canal, that is the ear canal, is 24 millimeter. Ear canal 24, the eustachian tube 36 millimeter. Okay, so further to CSOM. As the nose and the ear is connected, whenever we or whenever patients suffer from upper respiratory infection, this infection from the nose or throat through the eustachian tube, they travel and they reach up to the middle ear. First point is infection of the upper respiratory tract. It can also be called as a eustachian tube catarrh or eustachian tube disease. From this, the infection reaches the middle ear. As it reaches middle ear, the inflammatory process continues, and as the inflammation continues, there is production of clear fluid in the middle ear. This clear fluid in the middle ear is initially a serous fluid. Remember, it is serous, there is no pus, and this is called as a stage of serous otitis media. Another term for this is otitis media with effusion. At this stage, patient will just have fullness of the ear. There is no pain. So remember, no pain in otitis media with effusion, no pain in serous otitis media, just fullness of the ear is the symptom. In the body, whenever any fluid remains collected in the cavity, it gets infected. So this serous fluid starts getting infected, it forms pus. Whenever the pus forms in the body, it tries to create lot of pressure and it leads to very severe excruciating pain. This is the stage of pre-suppuration, also called as a part of ASOM, so acute suppurative otitis media. Once this pus is formed, it perforates the tympanic membrane and this pus comes out from the ear canal. This is the suppurative stage of otitis media. I will not go into detail because we have discussed this in the ASOM chapter or the ASOM class. Once this pus comes out, the patient has a perforation. This perforation stays there permanently or it can heal up. If it stays permanently, this condition is called as chronic suppurative otitis media. Remember, in chronic or in any chronic conditions of ENT, the patient will never complain of any pain. So to understand the pathology, the mucosal CSOM, also called as safe CSOM, also called as tubotympanic disease, it starts from upper respiratory infection like a ASOM, and when the perforation does not heal, This stage is, or this condition is called as chronic suppurative otitis media safe type. What are the points? Patient should have recurrent ear discharge, patient should have a permanent perforation, and patient has reduced hearing. So three important points: a permanent perforation should be there in the tympanic membrane, patient has reduced hearing, and this patient and the disease has started after episodes of acute suppurative otitis media. So this is the basic understanding of safe CSOM.